Good afternoon. My name is Joe Gazo. I'm a physical therapist with Total Sports Therapy, and I'm also the clinic director. We are joined today by Dr. Paul Ledesma for Total Sports Therapy Community Spotlight Series. Thank you for joining us today, Dr. Ledesma.
Thanks for having me, Joe.
And I was trying to think of how long we've known each other, and I'm going back to maybe like 2009, 2010.
Yeah.
That sound about right?
That's about right. We moved into Arizona. We had migrated away from the cold of Massachusetts, where I did a lot of my post-grad training and started practicing out there. And my wife was originally from this area when I met her, so we just decided to get closer to family. And end of 2009, we moved into Arizona up in Cave Creek, and I think we met at church. I think that was probably the first time.
Yeah, so we've known each other professionally and as friends. We went to the same church.
Yeah.
We lived in the same neighborhood.
We did, yeah, at one point.
And our kids went to the same school for a little bit.
And played the soccer team.
Yeah.
Yeah.
So I followed your journey in the valley that has led you to this very successful private practice, Ledesma Foot and Ankle.
Mm-hmm.
And so tell us, Dr. Ledesma, what do you specialize in?
So the basics are I'm a foot and ankle physician, surgeon. We do everything, treat every condition or malady that affects the foot or the ankle. As far as a specialty, I think in regards to what I like to and what I tend to see more of and have an interest in, it's probably more of your sports med type patients, both your amateur athletes, scholastic wise, any kid age. Quite honestly, if they're walking, I can treat them, and I enjoy that. But then going up to the more reconstructive type stuff, either post-injury, pre-injury type of care as well. That's non-surgical. I love getting into some of the new technologies that are available to help patients in that regards.
Okay. And what encouraged you to become a podiatrist?
So the story goes way back. My family in general, my father was a pediatrician. So medicine was always very familiar to me. It was in our family. My oldest sibling, followed his footsteps and became a pediatrician as well. Next one in line didn't start out in medicine, but ended up there in pharmacy. Mm-hmm. So we have a pharmacist as well as the next oldest down. We have one black sheep, one sister that decided to go IT, which I think she's probably the best suited for that and well off more than others. And then my brother's a physical therapist as well.
Okay.
When it came time for me to choose, like what am I going to do when I finish high school and am I going to go to college and whatnot, and I just very simply asked my father, it's like, hey Dad, you know me. He actually did a fellowship at Johns Hopkins for child psychiatry when he was getting his pediatrician's training. And I said, what do you think I should do? It's like, my personality. I kind of like medicine. What do you think? He only said this one little simple sentence. He said, go see Uncle Bob. And Uncle Bob was actually a podiatrist. Friend of the family. He wasn't my uncle, but family we grew up with in South Georgia. I'd known him all my life. I'd been to his house and never knew what he did until I was 16 years old. And I started a little early. I graduated just after I turned 18. So I started asking questions, and I actually went to see Uncle Bob, and I shadowed him for about a week during the summer. And that was it. I was hooked. Yeah. I was so fascinated with his practice, and which, oddly enough, is kind of a unique practice, especially for that time period. Very diverse. He saw clinical pathology, but also had a surgical suite built out of his office, and he did a lot of surgery. He was one of the first podiatrists in his town to actually do surgery at a hospital. Because back then, podiatry's obviously come a long way, but when he started practicing, there were no podiatrists doing actual surgery in the hospitals, which obviously has now changed. Mm-hmm. And he was one of those groundbreaking physicians in our field. So, and I think past that, I then went on to a colleague of his that he said, well, my buddy is a lot closer to you in Savannah, near where I grew up. And so I started shadowing his classmate. and ever since it's been my field.
So that 1 week with Uncle Bob, that did it.
That's what did it. Yeah,
That's neat.
yeah.
And where did you receive your doctorate?
So my doctorate I took at Barry University, which is located in Miami Shores in Florida. So again, I grew up in South Georgia, and then lots of the schools that were offering podiatric medicine degrees or doctorates in podiatric medicine they were kind of all over the country. It happened to be the closest one, and I had some family in that location, but it really just fit me in regards to when I did interviews. And so I finished a 4-year degree out of Barry University at Miami Shores.
Nice. So I understand that you worked as a physical therapy technician for 3 years.
Yeah.
Aquatic therapy.
Yeah.
So can you tell us about this experience and how it helped with your career path?
Yeah. So I went to college in South Georgia, so Georgia Southern University. And at the time, I knew I was interested in medicine. So again, like I said, I had been exposed to podiatry very early, even before graduating high school. And I toyed with the idea going into college with, as a basic pre-med, and said, okay, I'm going to keep my mind open and see what's out there. And, and physical therapy, because my brother had already started that path. And I was like, that's kind of interesting. I might be interested in doing that. And when I heard that my brother had started practicing in Miami, decided he wanted to move back to Georgia, close to town and basically close to home. And he said, well, I think I'm going to be working at this hospital-based outpatient clinic, which happened to be in the college town that I was going to college in. So it didn't hurt that he was my brother, but I got a job and started working there. And he worked, I think I worked with my brother as a PT tech for about 2 years. Mm-hmm. And it was an interesting setup. It was an old fitness gym that actually had a full-size pool and showers and hot tub and then a big open space for the gym area, right? So they converted it into a physical therapy office with aquatic therapy accessible. So myself and one other technician who was a good friend of mine, my brother actually made us go get our aquatic therapy certification. And quite honestly, if anything, it more solidified my idea of what I wanted to do. Mm-hmm. Just being in medicine in general, as you could attest as a PT, it's so rewarding to help people get through something. When you have goals set for the patient has their own goals, making them accountable to what they're trying to achieve and you helping them along their way. And once they get there, it's a nice feeling to help somebody achieve their goals when it comes to medicine and rehab. And so it gave me the idea of, okay, I like physical therapy, but I still like podiatric medicine more.
Sure.
So it kept me interested in medicine in general, and it was a great experience. I made, I think a lot of the way I deal with patients and talk to patients and communicate and connect with people, it started when I was actually a PT tech because we had our own patients. Mm-hmm. As you could see, I'm sure you kind of experienced this, that patients come in, 2 or 3 times a week, and you get set them up with they want consistency. Mm-hmm. So you get them set up with the same tech, and the therapist makes the treatment plan out, and then we as the techs take them through it and kind of work with them. Right. So developing that relationship and rapport, I think was an extremely valuable skill set for me, eventually getting into medicine and treating patients in the clinic setting.
It's interesting. So what area of town do you primarily serve?
So primarily, my office is located in North Scottsdale, North Phoenix, right off of Tatum and Bell. Mm-hmm. But quite honestly, Joe, I've seen patients all over the valley and outside of the valley. We get referrals from Prescott, Levine, Buckeye, Queen Creek. I've had people drive in from Payson. Wow. And even out of state, from Canada, from California. Yeah. But I'd say a majority of our patients are Greater Phoenix area. Okay. There's a lot of practices in this part of town in kind of the North Scottsdale region. But I think with what I offer patients, people tend to be okay with the drive.
Yeah. And the location's perfect because you have the 51.
Yeah.
just west of you, and then the 101 just north.
Yeah,
Yeah.
yeah, it seems to work out well.
So tell us how long you've been in practice.
So I started private practice in 2005. So I graduated, finished my residency program out of Boston at Cambridge Hospital, right in the midst of the Facebook birth. Actually, quick funny story: the hospital where I did all my training, right? I think there's a movie out called The Social Network that kind of highlights kind of a documentary type of Mark Zuckerberg. And the opening scene was at a bar. I don't know if you remember that. So they started, and he got into it with his girl, right? He was arguing with this girl that was kind of like a girlfriend. And they were at a bar, right? It was called The Thirsty Scholar. So that was our resident meeting place, because it's on the backside of Cambridge Hospital where I did my residency.
Interesting.
And I was there from 2002 to 2005. So right when Facebook was born in 2004.
Interesting.
So yeah.
So what interests you most about what you do as a podiatrist?
I think it's, as a podiatrist, I wouldn't say it's so much, twofold, I would say. Part of what I enjoy out of podiatry or medicine in general is just kind of what I touched on before, is just that ability to help patients and people achieve relief and achieve, better health.
Mm-hmm.
And it goes beyond just taking care of a foot issue. It opens up what they're able to then do in life, right? So quality of life for me is really one of the most important things I educate with patients, is that I want to improve your quality of life by helping you fix your foot problem. If that means I can help you go to Disneyland and enjoy walking with your kids because your foot doesn't hurt you, or hey, you can go to the beach now because your deformity isn't stopping you from walking on the sand. Those are the kind of things that I really enjoy about it, but it's not so much specific to medicine or to podiatry, but more just to medicine in general. I think a lot of physicians have that same feeling. Podiatry-wise, though, it is a unique specialty in that I think people many times, until they actually have a problem, take it for granted how much their feet do for them.
Sure.
And that's also the struggle we have as podiatrists and foot and ankle people, physicians. It's so underrated that there's so much ground force and energy that gets put into the foot and ankle. You think about all the body parts that you use on a daily basis, what takes the biggest beating on a regular basis?
Right.
If you're standing upright, it's going to be your feet. Not your hands, not your arms. No offense to all the other specialists out there.
Absolutely.
But the feet are, it's your foundation.
Yeah.
So it's critically important. And I think that's a unique and kind of cool feature that I enjoy about podiatry.
Interesting. So in the past, I've seen a few post-operative patients from you. What type of surgical procedures do you specialize in?
So I specialize in mostly reconstructive type procedures where there may be an existing structural deformity. Bunions are a real common thing that people associate with our specialty and field. But then there's also the more complicated or complex type issues, like people that deal or suffer from problems having more of a flatter foot or unstable foot type that needs to be stabilized. There's lots of cool procedures, and I tend to lean more towards the less invasive type procedures, not only for the reconstructive stuff, but also for just treating pathology, chronic pain. Heel pain's a huge reason why people walk in or come into our office. And there's so many procedures nowadays that are less invasive, quicker recovery times and healing, and just overall better patient satisfaction.
Okay. Now, before we started filming, you gave me a tour of the office. You showed me some of your equipment, the cold laser, the shockwave therapy. Are there any other new treatments or procedures that you integrate into your practice?
So there have been a few. Lately, it's been more gravitating towards wound care, which, oddly enough, I've always been fascinated by wounds, and a large part of my residency training in the hospital time spent taking care of diabetic patients in particular, which is one very common group to suffer from wounds in the feet and foot and ankle. And we were on the cutting edge of technologies back then when I was in the training and doing biologic type tissues to cover and help the wounds heal. And that has really just kept evolving over time. And one of the really neat things that we're doing now, one of the aspects of treating wounds or chronic wounds, or that would facilitate the healing of, was hyperbaric oxygen. So I'm sure you've seen that or had patients go to it, right? So now they've created different ways for people to experience hyper-oxygenated environments, but more on a local level. So we actually have a machine was just released last year by the creator, and it can provide a hyper-oxygenated environment to just your leg, to the extremity. It's proprietary equipment. There's only a few in Arizona. We were one of the first clinics to have it. So it's oxygenated mist therapy, super oxygenated mist that penetrates and saturates the tissues, and it can contain it to just one body part, one extremity. So it's really cool stuff.
Okay.
And keeps people out of a chamber, which
and you do that right here in the office. You don't have to go anywhere. Okay.
Right here in the office. Yeah.
Interesting.
So pretty cool stuff.
What do you see as a future treatment options in podiatric medicine?
So outside of the surgical realm, which they're always kind of tweaking stuff, there's new hardware that comes out every so often. Here's an old school procedure that now we can do it this way, and it's much safer, easier, more stable, and maybe better outcomes. But I think just to give a new procedure, let's say, or new movements and advancements in the field of podiatric medicine, I think it's going to come with some collaboration with the technology of today. iPhones, smart devices, taking advantage of that. And one of the cool things that I've seen, and we're actually going to be offering this in the pretty near future, is the technology to help evaluate patients on a more regular basis, like pressure sensors. So, and we've seen that come out in the past. It just never really took off, where we put insoles into a shoe that can read digitally what your pressures are when you're standing and walking on your feet, right?
Interesting.
Very critical and key for patients that are diabetic that don't have good nerve feeling or sensation, so if they're neuropathic. So it helps us to spot potential problems and maybe even before they break down into an ulcer. I think it's just going to expand beyond that. It's going to be more than just diabetic patients. And what about other deformities? What about other conditions? We're going to be getting a bath mat that you just stand on when you're brushing your teeth in the morning that'll highlight and sense if you're standing abnormally based on your track record and normals. And it'll send us an alert like, hey, do you know you've been putting too much pressure on your right foot compared to your left historically, and maybe you should come in for a recheck before things get bad.
Right.
So I think just the relationship between technology and the conditions that we see and hopefully can prevent at some point in time. I think there's going to be a lot more advancements in that field, and we're excited to kind of hopefully take advantage of that.
Interesting. So with the pandemic, what are some of the challenges you've faced in providing your services?
Yeah. So, I think fortunately for us as a business, we were deemed essential like many other medical type practices. And we wanted to make sure people knew that we were still open, because I think that was a real common question we were getting in the beginning. Are you guys open? And we deal with patients that have conditions, in particular, again, like diabetes. We see lots of patients on a regular basis to make sure they stay out of trouble. And they were worried and were concerned about coming in. It's like, are you still open? I really need to come see you. And with our specialty, it is very hands-on. So it was tough to try and even conceive shutting down or going to all telemedicine, because we do more than just talk to people. We actually do things in the office with them, do maintenance, do hands-on type procedures, minor procedures here in the office. So we did what we could to keep everyone safe. We made sure that everyone had the appropriate gear, masks, eye protection if possible. We were screening everyone as they walk in through the door with a temperature questionnaire regarding their most recent last 2 weeks of illness or exposure to other known parties. So we did what we thought was appropriate, and we've taken extra efforts in sanitation. We make sure we clean every single room after every patient. Using more advanced like mister systems to help cover and coat all the furniture, handles, and the doorknobs, the cabinetry, cleaning the floor. So we did everything we could and made sure people knew that we were trying to protect them. And even as far as checking people in while they're in their car, waiting for a room to actually open up. So there was no congregating in the office waiting room outside of maybe 1 or 2 people you could spread out social distance. So we did that as well.
Okay. So before we go, can you tell us if you're accepting new patients?
Absolutely. So we are accepting new patients, and we take most major insurances. We're on a lot of the networks, Medicare especially, and quite honestly, we'll see anyone. And even if you don't have insurance, we usually try to work out a nice, reasonable deal to just give a consultation to see what you might need, and if it's really something that needs more work, and it becomes a financial issue, we send it on to whoever's in network.
Okay.
Yeah.
And how easy is it to get an appointment with you?
It's very easy. Really, we just have patients call the main phone line and or contact us through the internet. So we have a contact us on our website link. So you can reach out to us through our website or directly through phone. And typically we can get patients in within 24 to 48 hours if needed.
Okay.
Yeah.
Well, that concludes our episode today. So thank you for your time. This is our first series with a podiatrist, so I think we broke some new ground today.
Awesome.
So thanks again.
It's been a pleasure, Joe, as always.
Thanks
for having me.
Thanks, guys.
All right.